What if the pills that you trust to heal you are secretly hurting you? In Kenya, hidden dangers may be hiding in your medicine cabinet. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Nderitu, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at the over-the-counter drugs and their impact on our health. How do people access over-the-counter drugs? Why do people choose over-the-counter drugs self-medication? What are the common sources of over-the-counter drugs? What are the benefits? What are the harms? And the solution and public policy. So how do people access over-the-counter drugs? Over-the-counter drugs are medications by definition which do not require any doctor's prescription. They are easily purchased from the chemist, the kiosk, the supermarket, even by the informal vendors. You can even find them under the mama boga's place, making them extremely accessible in urban and rural Kenya. So many consumers rely on self-diagnosis, all via Google, or WhatsApp groups, or word of mouth. So you diagnose yourself, you use Google, or you ask a friend, and then you treat yourself. So why do people choose over-the-counter medicines? It's cost savings. Of course, visiting a doctor, you need a consultation, and this can be expensive. When you go just for the drug, then this could be cheaper. Then convenience. Sometimes when you go to look for the doctor, you find that the doctor has a queue and you have to form part of the queue. Before you get to see the doctor, you have been part of the queue for long enough and you're already very tired and exhausted. So you want something that will give you immediate relief and give you an immediate solution. Then prior experience. I find this very common in my practice. When you give a patient a prescription, he gets some symptoms that he thinks they are the same related to what he had before, goes refills the prescription. People repeat what worked before. The only challenge with this is sometimes what you are diagnosed with might not be what you have now. And if it is the same, you may require a different type of treatment because possibly what you used did not work. And if it worked, possibly something has changed. Then perceived safety. Many people believe that over-the-counter drugs are harmless, and 62% of the people who use the over-the-counter drugs reported no side effects from the drugs, and so people tend to believe that over-the-counter drugs are safe and you can take them at your comfort or at your convenience. So where do people get these over-the-counter drugs from? We have licensed pharmacies, but many times we have these pharmacies that are also manned by people who have no qualifications and with minimal pharmacist oversight. We have unlicensed kiosk and informal vendors. We have online channels. These days people can access drugs online, and there are also online delivery services. Then Fred recommendations. Fred tells you this is good, especially for common complaints like headaches or acid reflux, and they will tell you what work and what they have taken or what they have taken. Or they can tell you that they can share the drugs with you. You have the symptoms that I had, so I can give you a drug that I think worked for me. It can also work for you. So what are some of the benefits of over-the-counter medications? As far as I am concerned, there are quite a number of the benefits that sometimes you can get from over-the-counter drugs. We also have had the Bamako initiatives where common ailments can be treated by community health workers when they are trained, and they can have access to some of the common medications like painkillers, antihistamines that they can be able to prescribe and give to the society. So there is immediate relief of pain, fever, allergy, and indigestion. That is very true. Empowerment enables individual to manage mild illnesses. At least you get to know some of the mild illnesses and you can be able to take care of them. It reduces the burden of the health system. You can imagine the shortages that we have of the health providers, and everybody has to go to the hospital and line up. So we have fewer clinic visits for common ailments. You may just did not have enough sleep. You just need to sleep or possibly take a painkiller to relax, and that will sort your headache. But despite the benefits, there are also serious dangers of over-the-counter drugs. Some of these hidden threats include misdiagnosis and long drug use. So you can have incorrect treatment, which may worsen serious illnesses and mask serious conditions. Sometimes you may just think this is just a headache when you could be having something like meningitis. Then you have dosage errors and overdose. When especially you don't read the instructions on the medication, and then combining of medicine, you can take paracetamol, take brufen, take diclofenac, drugs that work almost the same way, which can endanger your life. So over-the-counter drugs have a narrow safe dosing range, and overdose can cause organ damage or even death. Especially for people who have hypersensitivity reactions, some of these drugs can cause hypersensitivity reactions which can be life-threatening. Then you have drug interactions. You have been taking a particular drug, for example, for a particular treatment, then you take over-the-counter painkillers, plus some medication you are taking for blood pressure or blood sugar, and then there is interaction, and you can have dangerous interaction, either making some of the drugs impotent or there is add-ons on the side effects of the drug. Then you have addiction risk. We have some cough syrups that have codeine, which is one of the components of a number of cough syrups, and codeine, which is often combined with the paracetamol, and the available over the counter, can be addictive. So if you take it several times, then it's likely that you can get addicted, and this can be dangerous, especially among the young people. Then unsafe use of over-the-counter drugs in Kenya. We have drugs like diclofenac, which have been linked to kidney diseases and heart diseases. Drugs like omeprazole overuse, which lead to nutrient deficiencies and can also mask serious GI disease, which can be life-threatening. The codeine-based cough syrups are easy to abuse and can also affect individuals' functioning, leading to accident, either motor vehicle accident if you are driving, or workplace accidents, especially when you're dealing with machines. Then you have emerging local substances like cat, which or mira, which are legal but have some health risk like hypertension and dental issues when we take them excessively. These are also available readily. So what are some of the things that we need to do to be able to have over-the-counter drugs that are helpful and not endanger our lives? One is having stronger regulations and the enforcement. We need to reclassify the high-risk over-the-counter drugs like codeine, diclofenac, and omeprazole, so that they can be pharmacist-only or prescription-only drugs, so that we avoid abuse, and readily available for people who might not know some of the side effects these drugs might have. Then crack down on unlicensed kiosk and informal sellers, so that we avoid poor storage of drugs and making them important, and also at least have some knowledge on what should be combined with what. Then pharmacist involvement. Require pharmacists to consult and counsel buyers. Try to have some way of verifying symptoms before dispensing. I find this an improvement in the pharmacy area, because at least these days I say patients, they want to refill drug, but they are told before you refill this drug, you need to go back and see your doctor, which helps so that patients can also be monitored, and especially look for possible drug side effects so that we do not keep refilling drugs and they can lead to side effects. On many occasions, I have seen patients keep refilling steroids and they present with serious osteoporosis, they can present with serious GI symptoms, or they can present with serious diabetes from overuse of steroids. Then public education campaigns raise awareness of dangers of self-medication, importance of reading the labels when you are using drugs, and checking expiry dates, and also identifying fake medications. Then digital health tools. Use WhatsApp bots, SMS reminders, and apps for safe dosage information, and also alerts to help you take your drugs. Then integrate care pathways. Encourage follow-ups. If symptoms persist or intensify, visit a clinic. And the pharmacists should also be encouraged to do this. Collaborate with the primary care providers so that pharmacists and community health workers work together and they can be able to educate patients on safe use of drugs. So it is also important that we get into research and surveillance and support studies on over-the-counter drug misuses prevalence in Kenya, track trends, and work with various regulatory bodies that are available in the country, including the Pharmacy and Poisons Board, that we have safe use of drugs and ensure safety to the public. If you like this content, please subscribe to the Overall Health YouTube channel, and also share what has been some of your experiences with over-the-counter use of drugs. Have you had any side effects? Have you had any challenges? If you're a pharmacist or a drug person who is selling drugs, give your comments on what are some of the experiences that you have had with patients who are buying drugs over the counter. So thank you very much for watching. Remember that over the counter medicines can be healers or feelings in our health journey. So in Kenya, most of the dangerous drugs hide in plain sight. With stronger regulations and responsible use and smarter policies, we can be able to keep the benefits and cut the risks. So let's protect ourselves mindfully, safely, and together. Remember to like and share. Let's meet in the next video.